Welcome back. Thank you for your feedback, and maswali zote Nasroda will be able to answer them. And welcome back, Nasroda.
Thank you.
There's a question that has been sent to us about what if mnashuku mama after delivery, mnashuku huyo mtoto ni kama ako na HIV, amwezi mpea PrEP?
Okay, thank you so much. Actually, every child who is born of a positive, HIV positive mother is a suspect of HIV. Of course, the community does not understand why a child is born of a positive mother and turns negative. And therefore, I want to say, even to the viewers, that a mother who is HIV positive can deliver a child who becomes negative. And as the question has been asked, tunashuku, actually tunashuku, because that child is already exposed.
Yes.
So the exposure already is a suspicion. And therefore what we usually do, we introduce the prophylactic treatment. That is now what you are called the PrEP.
PrEP.
Yeah, for the child we say it's prophylactic treatment. So there are some drugs we give to the child so that we may prevent this child from acquiring HIV. Remember, this child will breastfeed immediately after birth. And therefore, we have to take some quick interventions. And this now is the quick intervention are these drugs that we give. These drugs are not for HIV treatment. They are for prevention. And this child will work with these drugs until it stops breastfeeding. And then after it stops breastfeeding, there are tests that we continually do, especially at 6 weeks. There is a test we do, it's called PCR, and DNA PCR test. Then after 6 months, we repeat the same. After 1 year, we do. And then at 18 months, this child is tested finally. And if this child has been turning negative, remember the child is still on preventive therapy, and at 18 months it turns negative. Now we approve this child is negative. But there is a time when we shall give preventive therapy. Remember, we are doing the first test at 6 weeks, and then our test becomes positive. Now, when the test becomes positive, because it's done through DNA test lab, we now say this child is positive. So we have children who become positive as early as 6 weeks, as early as 1 year, as early as 6 months, and they start now the true treatment of HIV. But for the child who is negative, for the first test, the second test, the third test, and the fourth test, we say that child is negative, and that's where we have children who are negative from HIV positive mothers.
Okay, and someone else is asking about the factors that contribute to mother-to-child transmission of HIV.
Factors that contribute to mother-to-child transmission. One factor is lack of, when the mother does not take ARVs, especially mothers who are depressed, mothers who have not accepted, mothers who have stigma, you know. So some mothers who will be tested, they test positive, they remain in stigma period for a long time, so they may not take ARVs. And so they increase the chances of transmission. There are others who, when they were contracting the disease, they had other opportunistic infections like TB. When you have an opportunistic infection like TB or meningitis, then there is a very high chance of transmitting, because your immunity remains very low. So it is either the mother has not taken drugs well, or rather she has taken drugs very late, or rather she has other diseases. Yeah.
Okay, and what is the process that you take when the mother, during child delivery for a mother who is HIV positive? Is it the same process with a mother who is HIV negative?
Yes, it's the normal and the same process of delivery. What we usually do, the midwife is already she is aware, because from the antenatal count, she'll realize that this mother is HIV positive. So there are some more improved precautions in delivery, and actually it is a normal delivery. But in mind she knows, the midwife knows that I'm dealing with a HIV positive woman. And therefore some procedures like the rupture of membranes, That's a procedure that midwives do so that they quicken the delivery. So we don't actually do early rupture of membranes. And when we realize that the membranes have ruptured spontaneously and they have taken time before the baby is born, then we take a precaution like a CS, an emergency CS is done. There is still something to consider. Sometimes when we get the viral load is too high,
Yes.
that mother is booked for a cesarean section, so that we avoid many procedures during delivery.
Okay.
Yeah.
And what is the advice that you give to a mother who has delivered, a mother who is HIV positive and has delivered? Should she breastfeed the kid?
Yes, yes. Then before, we used to tell mothers not to breastfeed, but that is at the time when the researches were not done fully. But now, a mother can breastfeed as long as she wants, only if she'll take her ARVs well, and also take other precautions like nutritional precaution, hygiene, and also counseling continues for the mother. But we have allowed them to breastfeed as long as they wish, and until she opts not to do so.
Okay, so as long as she takes the precautions that you've
As
given.
long as she takes the precautions, especially the ARVs.
Okay.
Yeah.
Now, I want you to give your final word and advice to a mother who is out there, who is HIV positive and is pregnant.
Okay.
Now is almost due.
Okay.
Just have your final word and advice to that.
Okay,
woman.
thank you. I would like viewers, and especially pregnant women, those who are very near to deliver, or even the others, I would like to encourage you that being HIV positive does not mean you will have an HIV positive baby. We are determined to have a generation which is HIV negative, and therefore we will take every precaution. What I would want to advise mothers or even women of childbearing age, it is good to attend antenatal clinics early, because that is where we detect these viruses and other diseases like hepatitis B and syphilis that we can treat early. We can do many interventions and we can help that child to come out negatively. Thank you.
Okay. Thank you so much for your time.
Thank you.
And for the discussion that we have had. As we have heard from Nurse Rhoda, having HIV doesn't mean that you'll have an HIV positive baby. So HIV is not a death sentence, and they do counseling. Na ni vizuri pia if you attend the counseling, because that helps a lot. That helps in dealing with stigma, right?
Yeah.
Yes. Until next time, that was our time. My name is Caroline Bide.
Thank you. Bye-bye.
Bye.